This is a special Family Red Table Talk to get straight, factual answers to our questions and yours about the coronavirus pandemic. Just like other families around the world, we are trying to navigate through all the information out there about COVID-19. Speaking of families, you will see that Jaden is not here with us today because he is actually being a responsible young person.
Yes.
He is practicing social distancing.
Absolutely.
He's been doing a lot of traveling, and his main concern has been about Gammy.
Yeah.
So he has decided to stay indoors, and he's actually following orders.
Yeah.
Which is great.
Thank you, Jaden.
He didn't care about us.
He's
He only cared
watching.
about Gammy.
He's watching, yeah.
So first let me say it's critical to listen to the experts and follow the guidelines, or more people will get sick and possibly die if we don't do or follow the guidelines that the experts are giving us. So.
Yeah, and I wanted to do this because in 2008 I made I Am Legend, so I feel responsible for a lot of the
Misinformation.
a lot of the misinformation.
Right.
And just as a family, we've been sitting down and we've been talking. And when I was preparing for I Am Legend, my character was a virologist. So
Right.
I had an opportunity in my preparation for the role to go to the CDC. And there was a basic foundational comprehension of viruses and viral pathogens that I developed, and it really changed my life and how I looked at the world. And there's basic concepts that people do not understand.
I mean, a lot of the language is very confusing.
Right.
Yeah.
Right.
You hear it on the news and you're reading on Twitter and
Right.
you know what I mean? So.
Right.
So what I wanted this to, for us to have that opportunity to just go through the basics and then, bring in the experts.
Okay. To tell us what we need to know is Dr. Michael Osterholm.
Mm-hmm.
I hope I said that
Yeah,
right.
that's my man.
That's good.
Dr. Michael Osterholm.
All right, good. He's one of the world's leading experts and on viruses and pandemics.
Absolutely.
And he is a medical detective who has led many outbreak investigations and advises world leaders on the ever-growing list of health threats.
When I went to the CDC, one of the concepts that I didn't know is the idea of a viral detective.
Right.
Yeah.
So in the same way that we have police officers and police detectives that investigate crimes,
Right.
Dr. Osterholm investigates viral outbreaks. And the reason why we have a CDC, even the reason why we have a World Health Organization, is there are people who do this. So for a lot of people, a lot of us at home, this is our first experience with it, but there are professionals and viral detectives and systems in place where people have dedicated their lives to fighting the battle between human beings and viruses.
Right. That's been going on forever.
There has never been a time in human history where human beings were not in a tug-of-war battle with viruses.
Right.
And Willow and I were talking the other night, and we were talking about like what is a virus.
And the
That's
difference
a really
between
basic
bacteria,
virus.
bacterial infection, viral infection, how
Right.
those are different, how they're different, contracting those things.
Absolutely. A virus is essentially a micro parasite, basically. So viruses use our cells to replicate themselves. Like a virus wants your whole body to be the virus. It
Right.
grabs your cells, uses your cells to make more of itself, and that's just what it wants to do. It wants to make as much of itself as it possibly can. It wants to replicate. It uses your cells, and when it uses up a cell, it moves to the next cell. Right? So, and a lot of times it damages or destroys, depending on what the virus is, damages or destroys the cell that it's leaving.
Got it.
Right?
Got it.
So that's what makes viruses difficult for human beings.
Got it. So the doctor is joining us from Minneapolis.
Minneapolis.
And we want to respect and abide by social distance and travel recommendations. So he is
Absolutely.
here with us by satellite. Hey, doctor!
Dr. Osterholm, how are you?
Hi there. How are you?
How are you doing?
We're good.
Thank you for having me.
Yeah, no, thank you very much for doing this.
Right.
This is my wife's show, but talking to you is really exciting for me. So,
Well, I think we could. I think we could actually call you Dr. Smith.
Oh,
With
there
all the
you go.
explanations
Love
you're
that.
giving. I think
Love
you.
that.
So did he
you
give
could
a
do that.
proper? Did he give a proper explanation on what a virus is, Doctor?
You
Did
know,
hear?
actually, better than most professionals I know. He did a great job.
Thank you, thank you, thank you. See, I told you. So Willow and I were talking the other night, and I think the first issue was when she hears terms like global pandemic.
Exactly.
So the term global pandemic to Willow means
Contagion.
Contagion, the movie
movie.
Contagion, or I Am Legend, or The Walking Dead. So when she hears global pandemic, when she hears mortality rates,
Right.
you know, she.
But I have a question for you, Doctor.
Yeah.
Because wouldn't the regular flu just be a global pandemic?
Well, actually, it can be. What a pandemic is, in terms of infectious diseases, is when it's a worldwide outbreak of a new virus or a new bacteria that is going to affect people in every continent of the world. So in this case, every once in a while, a new flu virus emerges out of the animal population and causes a flu pandemic. Most notably, many people remember or talking about the 1918 pandemic that was very severe around the world. And now we're actually seeing one almost like that, except it's being caused by a coronavirus.
Right, absolutely.
So how exactly do you get COVID-19?
Well, we're still learning a lot about how transmission occurs, but then we know a lot too. One of the things that's very notable about this virus is once it jumped into humans from animals, it was humans who transmitted to other humans. And we recognize now that because there's such dynamic transmission, I mean, it's more than 150 countries, it spreads very quickly, that just breathing itself is a very important part of the way it's transmitted. So as I breathe air in and out, obviously I need that. When I breathe out, the virus in some cases will just come out with my breath, and it will hang on very tiny particles that you can't see normally that I'm breathing out. If I get sick and I have a cough, it even becomes more pronounced what I'm breathing, and then you and I share breathing space, and that's how you get infected.
Well, can I ask a question? Because I was on the plane recently. I looked crazy because I had on masks and gloves. So can you explain why masks don't work?
Well, first of all, let's talk about which kind of mask. And I'll even mention the gloves, too, because I think that's an important point. There are different kinds of masks that we have today.
Right.
One is the surgical mask, which actually comes from the term surgery, where in the original days of surgery, a surgeon would, and people working in the surgical area would put this on so that when they talked or breathed, they didn't basically put these particles from their mouth that were coming out as they talked into the incision of the patient. And so it was really never meant to protect the surgeon. It was meant to basically protect the patient. But we've learned that with certain kinds of agents or bacteria or viruses that can be excreted into the air, that in some cases surgical masks will work and will help a lot. In this case, however, because of the very tiny particles that this virus is attached to, surgical masks don't work well. Remember all the spaces on the side of the face you see? That air just goes right through and around. Now, the other kind of mask that people will call a mask is what we call a respirator, an N95 respirator. That's a very tight face-fitting mask. It has basically the ability for air to go through what appears to be paper, but actually it's what we call a matrix. It's a pored material that lets air through, but not viruses. And so in that case, with healthcare workers in particular, we want them to be protected. We want them to wear an N95 mask. So for people just wearing the surgical mask, it doesn't really help you in this disease. You mentioned gloves, and I think it's very important to emphasize, you've heard a lot about hand washing, and as somebody who works with a lot of infectious diseases that are transmitted in terms of foodborne and from people who don't wash their hands well enough after using the bathroom, yes, hand washing is important. But with this disease, we now have enough information to say that it doesn't occur very often from the environment at all, touching a doorknob or whatever, and then putting your hand to your eye. It may occur rarely, but the most important way is just breathing in the air.
Really?
Wow.
Okay, so
okay, now that's a
That's
clarification
different.
right there.
So are you saying that this COVID-19 is airborne, that it exists in the air, or is there a specific amount of time that it actually exists in the air?
Well, you know, some viruses are very capable of surviving long distances. We once had an outbreak here in the Minneapolis-St. Paul area when the Special Olympics came here. And on the opening night ceremony, a young man from Argentina was just coming down with measles, another type of viral infectious disease that can be transmitted via air. And he actually stood on what is home plate in this big stadium, indoor stadium, and stood there all night. And next day we realized he had measles, and people who were there as part of the Special Olympics, a number of them came down with measles just from being near him. But we had a few cases that the only exposure they had to the opening night session was being at the Olympics, with that opening night session. And it turned out that they all sat in the upper right field bleachers, way up where nobody could hit a home run. And when we did the studies, we could show that the air came off of the infield behind home plate, and it bounced all the way up into the right field bleachers. And some 480 feet away, this young boy infected those people. Now, that's an extreme case of a virus moving. With this disease, we think it's more kind of a circle around a case, so not just 3 to 6 feet, but in a room like you're in right now, if one of you had this infection, you might be over time transmitted to everyone sitting around the table. So it's not going to go out of the room necessarily or whatever, but it could infect more people than just the person sitting next to you.
Okay, so it wouldn't travel beyond this room, though. So it's not the same kind of virus like the measles.
We're thinking 3 to 6 feet essentially is the current information, correct?
Well, we're actually expanding that now that we know more. Just in the past week, even since you and I have talked previously, Dr. Smith, it has actually expanded a bit. And now that we know that they're in this very tiny particles in the air, so it's not going to be like in the baseball stadium, but surely in a room like this, it could, in fact, occur. And think of that with regard to the different cruise ship outbreaks we had.
Right.
The Diamond Princess, where hundreds of people became infected. We now have good reason to know that the virus moved through the air circulation between rooms in the inner cabins. So that wasn't 3 to 6 feet. That was throughout the cabins of the entire ship. And so it can do that.
So I want to take a second right now, because this is where I can feel Willow feeling the anxiety around the information. So I want to take a minute with this concept. Right. So viral transmission in general can be fluid to fluid. It can be blood to blood. For example, with AIDS, AIDS is transmitted blood to blood, and this pandemic is transmitted airborne, right? So airborne is the most difficult to contain because it's airborne.
That's right.
So Dr. Osterholm, the COVID-19 actually can be transmitted from your hand to your eye, in your nose, less in your mouth, or digging in your ear. You can have COVID-19 on your hand and self-infect. Is that correct?
That is correct, although it probably doesn't happen that often.
Got it.
The more common way is in the air.
Got
But to help you understand that you deal with this every winter when you have influenza in the community.
Yeah.
Think of it just like influenza.
Yeah.
When you go into a public space, you don't sit there and think to yourself, oh my, that person may have influenza. But in fact, we do see it spread around the country. I think, Will, the most important piece of information I can share with you today is that fortunately with this virus, very, very few kids get sick when they get infected. And of those who do get sick, they're often mild illnesses. And so the good news to you is that you don't really have to worry about this as a really big danger to you. On the other hand, to your grandparents or to your friends who are over age 55 or 60. Now you need to start thinking about them. They're the ones that are at greater risk, but you're actually in pretty good shape.
So should young people be the ones that are more aware of like, okay, I need to stay home? Like, because I've heard that you can have it and not even know you have it and not even have any symptoms.
That's exactly right. It may happen, particularly in children, that they don't even know they have it, or it's a very mild kind of illness where you just may feel tired for a day or two.
The difficult conversation is mortality rate. And I think that is a really critical thing that Will and I were talking about Trey and I were talking about the other night. Dr. Osterholm, can you discuss mortality rate?
Well, first of all, let me just make the point. I think we've really covered some important information here. A disease really is important to us as humans when how it's transmitted and how often you get severely ill. You know, one of the most common diseases that we all get is the common cold. And believe it or not, that's actually transmitted by another type of coronavirus. Now, none of us would suggest for a moment that that's a big, serious public health problem because we don't get that sick. None of us are hospitalized for it. And so that's one that even though all of us get it, we don't worry about. Other diseases may not happen very often, but when they do, they're really bad in terms of how they actually cause harm to us. The people are in the hospital or they get sick and even die. This disease is kind of in the middle. And what I mean by that is it is easily transmitted. We estimate that as many as 20 to 60% of the United States residents may very well get this over the course of the next 6 to 12 months. Now the challenge is, who is it going to severely hurt? And as we already just discussed, kids fortunately are at the very low end, meaning severe disease is very rare, death is even more rare. The problem is it affects older people who have underlying health problems. In China, where we first saw this emerge, older men who smoked, up to 12% of them died. And that was because not only were they not as capable of fighting the virus off, but the smoking made them more vulnerable. And so one of the things we're looking for is how to protect the most vulnerable people, whose immune systems are not working quite well because they have cancer, who may have some kidney disease problems, who has what we call COPD or congestive heart disease and lung problems. And so those are the people we want to make sure that they don't get exposed to this virus. And then that's exactly, as you said, Dr. Smith, the idea that in fact they won't be dying because they don't ever get it. And so if a whole lot of people get it that aren't going to get seriously ill, that's not good, but it sure isn't bad. It's only when we let the people who are most likely to have serious illness get sick. And that's our job, is to try to prevent that from happening.
Right. Would you also say that part of this, these guidelines that are being put in as well are, you know, to make sure that we don't overwhelm our hospitals and our medical staff across the nation, considering that, would you also say that we're pretty much past containment, that now this is just about hunkering down and just being prepared for the inevitable wave?
Right.
Yeah, I think you've said that very well. Let me just add one context to that. I have said on multiple occasions that as goes the healthcare system, will go how the country feels about this experience. And we learned that in China, where 4,600 healthcare workers became infected with this virus, many of them while working. In this country, we unfortunately are less prepared today to handle a situation like this than we were when I wrote my first article on this back in 2005. And the reason is our healthcare systems have been having taken more and more capability out of the system because it costs money. Today there aren't extra beds. There aren't extra ventilators around. There's not great capacity. At one time, hospitals used to stockpile certain kinds of these N95 respirators I talked about earlier. They don't anymore. And so now all of a sudden we need to protect our healthcare workers so they can take care of us. And when a healthcare worker gets sick and goes from being a care provider to being someone who needs care, that is a big hit on the system. And so one of the things we're trying very hard to do today is make sure that we can give the best health care we can, because that will mean more people will survive and do better with this illness. And it also means that it will have our healthcare workers there to help us when we need them, and we don't want them getting sick. So